depigmentation of the skin where, for example, an African American might have white splotches of skin?
Yes.
Okay.
And he had a polyp of his colon. And then we also sent portions of the autopsy to specialists in various areas. So the nervous system showed mild diffuse swelling. The lung examination showed some chronic inflammation and scarring in the lungs. The radiology examination showed an extra rib and also some arthritis. And then we did a dental examination which showed that there had been some root canal therapy and implant therapy. And we also did an anesthesiology consultation.
All right. And were there observations made as to a previous injury sustained in the scalp area?
Yes.
Dr. Rodgers, you can help me out a little bit. For purposes of our internal sound system, we may not be picking up everything. So if you could speak a little bit louder, it'll help us out in court. Thank you.
And regarding the scalp, what was observed?
There was an area of irregular pigmentation at about the top of the scalp.
Were you aware that his scalp had caught on fire many years prior?
Yes.
And that was through filming of a commercial where there was an accident that took place?
Yes.
Now, when you conducted this autopsy, did you know the height and weight of Mr. Jackson?
Yes.
And how tall was he and how much did he weigh, please?
He was 5'9" and weighed 136 pounds.
And what is the body mass index?
That's a single number that you can calculate from height and weight to give you a general idea of whether the person is underweight, normal weight, or overweight.
And with Mr. Jackson's height, his weight being 136 pounds, where did he fall on the body mass index?
He was within the normal range.
He was, however, a very thin individual. Is that fair to say? Or a thin individual?
Yes, he was thinner than most, I believe.
But according to the body mass index, he fell within what would be described as normal.
That's correct.
And was a photograph or photographs taken documenting Mr. Jackson's general physical condition on that date, which also shows his general weight of his body, at least visually?
Yes.
And I have a photograph taken at the time of autopsy. Defense and the court's previously seen it. It has been blacked out in the genital area, Your Honor. May this be marked Peoples 206 for identification?
Yes.
Dr. Rodgers, showing you what's been marked as Peoples 206 for identification, does this bear the coroner's case number 209-04415?
Yes.
And this was taken on June 26, 2009?
Well, I'm having a little trouble reading the number. It may either be the 26th or the 25th.
Oops. Absolutely. What is that date reference?
Well, to me that looks like 6/25/2009.
Actually, looks like the wrong date is on there. Looks like 8/25/2009, doesn't it?
Well, it does look a little bit like an 8.
Was this a picture taken of Michael Jackson's, at the time of Michael Jackson's autopsy, bearing the number 2009-04415?
Yes.
And does this accurately depict his body and visually depict his weight on the date of June 26, 2009 when you conducted the autopsy?
Yes.
Exhibit removed.
Now, in regard to your evaluation of the internal organs of Mr. Jackson, I'd like to ask you about his heart. Were you able to draw conclusions related to his heart, whether he had any heart disease and things of that nature?
He did not have heart disease.
Were there any abnormalities noted by you regarding his heart?
No.
Did you make any observations regarding his coronary arteries?
The coronary arteries did not show any atherosclerosis.
Was that unusual?
In this context, yes.
What do you mean by that in this context?
Well, he was 50 years old. At the age of 50, almost everybody has some atherosclerosis in their coronary arteries, but he didn't have any.
What is atherosclerosis?
That's a buildup of fat and cholesterol on the walls of the blood vessels.
Okay, and Mr. Jackson did not have any buildup of this fat or cholesterol on the walls. Is that accurate?
Yes, in the heart.
In the heart, and that was unusual based on his age.
Yes.
Was that a factor that led you to conclude that, generally speaking, he was a healthy individual for his age?
Yes.
Now, did you observe any trauma or any natural disease in conducting your autopsy that would have led you to conclude that that was a cause of death?
No.
Did you make observations regarding his esophagus?
Yes.
And was his esophagus intact throughout?
Yes, it was.
Did you see any...
I have COPD.